Dallas cardiologist Richard Snyder is the president-elect of the 56,000-member Texas Medical Association. He assumes the reins of the physician organization at a time when a pandemic has changed healthcare. He joins Fox 4's Shaun Rabb in this week's Here and Now.
I am visiting with Dr. Rick Snyder, Dallas cardiologist, but the president-elect of the Texas Medical Association, TMA. Congratulations first.
Thank you very much. It's an honor.
What do you see the mission, sir, that you will embark on as the leader?
Well, as a leader of the Texas Medical Association, our vision is to improve the health of all Texans. And our mission is to stand up for physicians and provide innovative solutions to the challenges we face for providing access and care to our patients. So I would have to say the first thing is it's going to be access to care. As you know, our state has one of the highest uninsured rates in the country. And to the extent that insurance is a big barrier to access, that's a problem. But it's got to be much more than just coverage. Coverage is not the same thing as access, and access to care, access to a waiting list is not access to health care. Obviously, the nursing shortage is a big barrier to access to care right now. We have a lot of hospital beds sometimes, but don't have enough nurses.
I was going to ask about the Great Resignation, and the medical profession has not been immune from that in Texas.
No, not at all. I think you've seen some physicians begin to look at their retirement a little bit earlier. I think for some of the older physicians, again, those are the ones going to be at the highest risk from coronavirus. They felt that maybe the time is to slow down or to cut back. We need to increase the nursing schools, medical schools, but also provide that financial coverage to allow patients to see physicians in the healthcare system.
Your concerns as the leader of the TMA in getting politicians, local, state, national, to understand we kind of need to have some autonomy in deciding how to move forward in healthcare the best way for our citizens. And that's a challenge.
And that is a challenge. And, when we were with the TMA, we met with the governor's office, we met with local, state, national leaders, and there is a panacea. There's no one size fits all. We have 254 counties in Texas. The vaccination rate in Collin County may be different from South Dallas County. The infectivity rate may be different. The amount of healthcare providers who are willing to get the vaccination. So our message to the governor, county commissioner is let the local officials make the best decision that's right for them. Let the individual schools, let the individual hospitals, give them the freedom to choose. Because, for example, some hospitals in rural Texas only had 60% of their nursing staff that were vaccinated. If you were to mandate have a vaccine mandate to be able to work there, you're probably going to face the prospect of having to shut those hospital facilities down, which would have been a worse prospect. Our pitch to the governor's office is let the local hospitals, let the local school district make the right decision, give them the freedom to choose, the same way as a lot of private different cardiology offices or physician offices were making was the right choice for them.
Okay, Dr. Snyder, I'm here anytime, sir. Mm-hmm. As you go forward, don't hesitate to reach out, please.
Absolutely.
All right. Congratulations again, and thank you.
Thank you very much.